Okay, so just to not fall too behind, I'm going to go ahead and get started, and then as people join, Mariah will let them in the room. But hi, everyone. My name is Michelle Fernandez Gavilon. I'm the Associate Director of Workforce Development here at ACU. So excited to have you for our fall edition of our Recruitment Boot Camp Mental Health Staff Edition. One quick disclaimer, I'm having some Wi-Fi issues, so if at any point I freeze or you can't hear me, you can't see my slides, anything like that, please let me know, and then I will try to call back in or something. But I just really appreciate all the grace, as of course the moment I need it is when my Wi-Fi decides to be a little bit tricky. But I think as for right now it's working, so we should be all good, and let's go ahead and get started. So today's session 1 out of 5 sessions that we will be doing through November. Very excited to have everyone here today. So this is me. You will get all of these slides as well as a welcome packet. I believe Mariah Blake has sent that to you via email. We're also posting this in our discussion board, and I'll go through all of these details in a moment, but you have my email here if you need it. At any point throughout the Learning Collaborative, you can contact me. We can also offer one-on-one technical assistance. So we're really here to help and really give you the best experience that we can. So just to go through some housekeeping items as we get started. And this will be throughout the entire Learning Collaborative. So each session is being recorded, and then the recording is going to be posted on the discussion board. So we really just want everybody to be present, if possible, be on camera. I do see some of you are, I believe, because I'm also trying to share, so I can't see everyone at the moment, but we'll have times where I'll put down the slides. We'll be able to see each other. We'll have breakout groups, things like that. So really, ideally, if you can, please be on camera. We just really love that engagement. You can also use the chat box. So at any time while I'm presenting, if you have any questions, go ahead and put your questions in the chat box. You can also go ahead and just put any comments, thoughts, whatever you need. And if you would like to unmute yourself to share any thoughts, please feel free to do that as well. So at any point during the presentation, please feel free. We really want this to just be a welcoming environment for everyone. Mariah Blake, our program manager, she is on the call today. If you have any technical difficulties, she will be your go-to. So you can send her a chat, or you can just reach out to her directly. She has sent you a few emails, but her email is mblake@clinicians.org. And then after each session, we are going to be doing an evaluation, but I am also going to leave just a quick moment here at the beginning. We like to do a pre-assessment and a post-assessment. So before the Learning Collaborative starts and after it finishes. So Mariah is going to put that pre-assessment in the chat in a moment. And before we got started, I wanted to give everyone just a few minutes. It's 3 short questions on a Likert scale. So it will definitely not take too long. And then at the end of the session, we'll do our post-session evaluation. So just trying to differentiate between the two. Oh, perfect. And Mariah went ahead and put it in the chat box. So what I'm going to do, I'm going to go to the next slide. But what I'm going to ask, if everyone could just go ahead, fill out that quick pre-assessment, and then we will continue in just a moment. Okay, I'm just going to give it one more moment, and then I'll go ahead and continue. Oh, yes, and if you are just joining, we have in the chat a pre-assessment evaluation. It's 3 questions that we're asking all of you to fill out before we get started with the Learning Collaborative. So if you could please go on there, 3 short questions on a Likert scale, that would be wonderful. Okay. So just with these intro slides, we won't do this for every session, but just to give you a sense of who we are. So we're the Association of Clinicians for the Underserved. Exactly as it says in the slide, our focus is access to care, and we offer clinician support. We're really focused on building the transdisciplinary team, focus on recruitment and retention. We offer resources, training, networking, and we were funded 25 years ago, so it's our 25-year anniversary by National Health Service Corps alumni, so that's still very much at the foundation of what we do. We also offer various programs, with one of them being the STAR Center. So that's where all of you are here today for this learning collaborative through the STAR Center. And we were awarded our National Cooperative Agreement in 2014. We are funded by the Bureau of Primary Healthcare, one of the 21 National Training and Technical Assistance Partners. And we produce and offer to all of you free resources, training, and technical assistance. So as this learning collaborative goes on, as I said, for those who may not have heard this in the beginning, if you have any questions throughout, whether it's related to this learning collaborative or anything else regarding clinician recruitment and retention, you can feel free to reach out to us, and we offer you that one-on-one technical assistance. Our website on here, which you'll also be going to, this is where we have our discussion board, and Mariah will be sending you all the details on how to access that. We have free resources on there. A lot of the homework that we'll be building throughout the learning collaborative will have you go on there and access all the materials. And also the info at chcworkforce.org does go directly to me, and I filter it to the appropriate team members. So I'm just going to talk generally about some of the goals of our recruitment boot camp. So this one is specifically focused, as all of you know, that's why you joined, on mental health providers. But we do have just some general goals in the way that we look at how we conduct our learning collaboratives that are a recruitment boot camp. So we have this one for mental health providers. We have one that is just general for all type of clinical providers. And we also have one for dental providers. So we really try to hone in on specific areas. But overall, the focus is about building a strategy, building processes, and building relationships. So we really want all of you to learn from all the materials that are being presented here. In a moment, I'll explain. We're going to have expert faculty in the upcoming sessions, and really learn from each other as well. I'm so sorry. I'm also severely allergic to the cat that's in the room. So it has been quite the day. I apologize. We want you to share your challenges and strengths. So we're really going to build in time for you guys to be able to talk to each other. So come in with questions, be open to discussion. Feel free to stop me at any point. You know, we want you to leave with new knowledge or really enhancing the knowledge that you already have. So new ideas, updated processes, and ultimately develop and implement that strategy. So really that retention and recruitment plan to be able to bring in qualified mental health providers. The same with the tools that we're going to use that we use in any of our boot camps, but in this one, we're going to have live webinar sessions. There's going to be 5 of them total. We're going to do breakout groups. We'll actually do one a little bit later today. As I said, we're going to dedicate time for discussion. It's going to be assignments, resources, tools. Discussion board access will be on our website. That is the chcworkforce.org. Technical assistance if needed, you can always reach out to me. And then we're also going to do a follow-up with you at the 3 to 6 month mark after the learning collaborative ends, just to see how you're implementing everything. How are things going and where can we help you? Because that's really what our goal is. And then this is also in your welcome packet, but just to kind of go over it very quickly, you know, our specific learning collaboratives is really understanding those needs and special considerations for recruiting and retaining mental health providers. One thing that I also do want to point out is, obviously this is called Recruitment Boot Camp. We're going to be focused on recruitment, but recruitment also doesn't exist in a silo. So we also need to look at it in relation to retention. We need to look at it in relation to an entire comprehensive workforce plan. So at times you'll hear me talking about a lot of these other different subjects for that reason, because they shouldn't exist in a silo. We're gonna, examine what is the role of mental health providers, especially as part of the primary care team. This is really going to be the focus of session 2. And then the importance of creating a comprehensive workforce plan that is focused on those mental health providers. And then in the end, we want you to leave with that recruitment plan, and we want you to implement the recruitment plan. And then, as I mentioned, our upcoming sessions, we're going to have 2 expert faculty. So in session 2, we're going to have Dr. Courtney Pladsen. She is a nurse practitioner. She's the Director of Clinical and Quality Improvement at the National Healthcare for the Homeless Council. And she'll be talking about the integration of mental health into primary care, the importance of that team-based care model, and how that brings in qualified mental health providers. And then in session 3 and 4, we're going to have Dr. Adija Owinyemi. She is a licensed clinical social worker. She has worked most of her career at a health center in the Detroit area. She also led our previous learning collaborative, so we're really excited to have her back. So session 2, it's going to be all Dr. Pladsen. Session 3 and 4, it's going to be all Dr. Owinyemi. And then when we come back to session 5, you're going to be back with me, and we're going to do a case study, really apply everything that we've learned throughout all of these weeks. So I want everyone to also be able to know each other, because a big part of the learning process is your cohort. So if you could put in the chat box your name, your health center and location, ideally your job role, position, and your preferred learning style. You don't have to put all this, so whatever you're comfortable with providing, but I really just want all of you to have a moment to be able to say hi to your cohort members. And then if you prefer, you can also go off mute and introduce yourself. So let me see if I can see everyone in the chat while I'm sharing. And thank you for all the people on camera. I see all of you, so hello. And as I mentioned, all of you are going to have definitely plenty of time to talk to each other. So, you know, we just want, so hello, Claudia. Oh, wonderful. Let's see, hi, Kevin. Nice to meet you. Rhonda. Kristen, Betsy. Thank you, everyone, for putting that in the chat. Nicole, wonderful. And I'm excited to see how we have like a really great mix of people in different roles. So that is awesome. Hi, Kevin. Oh, you're from Whitman Walker. Awesome. I actually go to Whitman Walker, so welcome. That's so excited. I'm located in Washington, D.C., so that's how I know that health center. Kristen. And then, yes, Helen, she is our training specialist here at AC, so she's also on the call and will be able to assist you. Hi, Karen, also from DC. Awesome. Okay, great. So, and again, anybody at any point, unmute yourself. You can interrupt me. I don't get offended by that. I want you guys really for this to be your space. So let's start to kind of lay the foundation for what we're going to be talking about. And one thing that I want to point out is, and we'll have this later on in the presentation, we are going to go through the core topics that here at ACU when we talk about recruitment. What are those key steps, our recruitment ladder? But we're going to really, really hone in on the ones that are specifically focused for the needs of mental health providers. But before I start all of this, I want to talk about the changing workforce landscape. So this is no mystery to any of you. I think all of you have experiences. Recruiting right now is incredibly, incredibly difficult. Oh, and I see Nicole. You also put hi, and I see that there's also a bunch of social workers, which is awesome. I'm a social worker myself, so that's always exciting. But you know, we're talking about the Great Resignation, and I'm sure all of you have seen that in the news. And one thing that I want to remind everyone as we go through this, you know, we're really going to talk about tools you can use, how you can work on your recruitment plans, aspects of retention, how to integrate mental health providers into the culture of your health center. But there's also a certain level of this that is out of our control. And that can be incredibly difficult because right now things when it comes to workforce are hard. People are leaving, people are choosing to leave their jobs for many, many different reasons. So I want to really highlight that and let all of you know that that is also okay. And what we're hoping to do is give you the space to really evaluate essentially what is going on in your health centers, give you the tools that you need to succeed in that, and then grow your recruitment efforts from that. So, but I do want to start with just acknowledging things kind of suck right now. So that's just my very honest sort of way of phrasing it. But it doesn't mean that you can't work to improve this, and that's what this is all about. It's about assessing, evaluating, putting forth the best ways to recruit someone into this field. So just to start off, the concept of change is essential, inevitable, and it's constant. So the COVID-19 pandemic and all the social justice movements have changed the workforce permanently. So health centers leadership really need to embrace and adapt to this change. And that has also been one of the biggest barriers that we hear a lot of times from people who are doing recruiting, is that leadership buy-in and that barrier that people are facing. Because, many of you probably know, if we tried this, this would be great. If we did this, maybe we could kind of overcome this. But is leadership taking a role in it? So also with the leadership documents that we had all of you sign, that was also our hope to kind of hone in from the beginning with them and saying, we really want to educate and teach your staff these steps, but they need to be implemented in your health center in order for things to work. And one of the most important things is simply acknowledging and embracing that change. And this comes in many different places. When you're going the new generation of workers that are coming in, and of course, this is specifically for the mental health space, but it really doesn't matter for any staff in the health center. There's certain things that really are going to be highlighted as important, really going to capture the individuals who are coming to work at your health center. So one of them being hybrid workspaces. It really is not an option. It is just an expectation. So places and organizations that are kind of fighting that to go back to the regular, you have to be in the office, are not going to be successful with that. Or I've read a lot of different organizations, what they have done is said, okay, you can work from home. Now, of course, it's not appropriate for every type of job, especially for some clinicians, but in general, hybrid workspaces, where some organizations have said to people, yes, you can go ahead, you can work from home, but you have to hire a babysitter for your children, or so already those restrictions are back in place, and it's really, people are saying, okay, I can just go somewhere else. The multi-generational staff that you have, you really need to understand the needs of the millennials and Gen Z that are coming in, because they're the ones coming into the workforce. Millennials have been in the workforce for over 10 years or more now, but Gen Z as well. So think about succession planning, all the baby boomers that are retiring, and all the people that are leaving healthcare. And we'll talk about that in a moment. Compensation equity is probably one of the biggest topics right now, and it should be of utmost importance. It is going to be really difficult to sort of stand behind saying, well, we can't quite meet the compensation the same way. So how can you get creative with that when you're competing with other healthcare organizations? And finally, that pipeline development. Oh, hi, Deborah. I see that. You just put in the chat, and Karen as well. I hope if I missed anyone, my apologies, but welcome everyone. We need to be prepared with the pipeline development. And one of the really important things for this, and what we'll learn throughout this learning collaborative, is that's why the preparation needs to be in place. So today is just sort of an introductory session to just lay the groundwork with everything. But as we talked about the Great Resignation, since July 2021, already 4 million Americans have quit their job. And the highest resignation rates are in those mid-career professionals. So from the article, which is linked here, it talks about people within the age bracket of 30 to 45. And simply because they tend to have more flexibility with the ability to resign from a position. So they're taking that. They're also reevaluating, that work is not everything in their life. They're back home. They want to be with their families, enjoy more time to, well, now, travel isn't as easy, but those type of things, just enjoy things in life, have a better work-life balance. And as it says here, and I'm sure not a surprise to any of you, the highest resignation rates are in healthcare and the tech industries, two industries that really were kind of pushed, the workers were pushed very hard during this COVID pandemic. And that's another thing for people is that even if this was what they wanted to do, they found through this pandemic that this is simply not the place where they want to be anymore. So, you're always going to have a certain percentage of people that no matter how great the recruitment tactics are, they simply have decided that healthcare is no longer for them. And when we look at mental health, the burnout rates, the difficulty of doing that job, often not, compensated to the amount of work that is being put in, the amount of demand that is happening. So there's just a lot of things that are taking place. So how do you address these problems? And what we'll talk throughout this learning collaborative is you need to have a data-driven approach, and that's going to be really important. That's also going to be based on one of the first homework that we will talk about for today. You need to see what is the cost of this, who is leaving, and bring that to leadership as the way to gain that buy-in for these sort of more innovative recruitment strategies that you're going to learn. Identify what are the root causes. Is it solely COVID where people have decided, where this is not the job for me? Or was this something that was brewing from before? Changes in organizational culture, compensation issues, benefit issues, burnout, well-being, all of those things. You have to look and again, go back to that data component to see where those root causes are. And then finally, which is the goal at the end of this, is to develop that comprehensive workforce plan that, yes, you have to do, it's required, HRSA requires it, but really we want it to be a dynamic plan that actually is going to allow you to recruit the qualified individuals that you're looking for that have taken so long to recruit. So I thought, everybody learns in a different way. Everybody likes a different learning style. And I heard this, it was at NPR, and I thought it was just it was two workers talking about why they chose to quit their jobs. Oh yeah, so Rhonda, so all of this is, because this is the first session, I wanted to lay down the foundation of just speaking sort of a little bit broader on the full workforce. However, everything specifically qualifies to mental health professionals, and all of the sessions, we are going to focus in on those key areas that you need to look at when it comes to mental health professionals. So in a few slides later on, I'm going to talk about what are the recruitment sections we're going to talk about throughout this learning collaborative, all of those things. But, in order to fully understand, I think it's important to understand just the dynamics of the full workforce, what is going on, because it really is no different on what mental health professionals are experiencing. However, then there's very specific tactics and very specific things to focus on when it comes to mental health professionals. But yeah, just for this one, it was just ensuring that we have the foundation across the board for everyone. Okay, so I'm going to play, it's a short 4-minute little clip. Okay, wonderful. Yeah, and absolutely, yeah. The focus, and I just want to reiterate, the focus of this is definitely like, how can you recruit those mental health providers? But the first session always, like I said, just kind of laying the groundwork for everything. So this is not going to be specifically mental health providers, but this is really important. I think what they're saying is no different for why mental health practitioners are leaving the field. I've known a lot of the social workers who I've known are actually leaving working at their health centers simply because there were no opportunities for upward movement. They've been there for 10, 14 years, and mental health providers are often not thought about as going into a C-suite role or into a leadership role, or the work-life balance wasn't there, or it's because you're a mental health provider, you kind of always wanted to just do therapy or case management. That flexibility just didn't exist. So what these workers are saying is very much in line with that, but within the field that they work in. So if everyone can let me know if you can hear, let me see if this. Sorry about that.
Just as employers are facing labor shortages. And Jeremy Gobieski got his first restaurant job at 16 as a dishwasher at a big place. He's worked his way up to 26.
Oh, okay. Sorry, apparently it's not playing, like can't really hear it. And if I push the chat, it stops the audio. Let me try one more time, and if not, you can go to the slides and listen to it yourself. Basically, it's kind of everything that we've been discussing, but right, and that's what I was trying to do. Let me see, give me 1 second. Oh, here we go. Thank you, Kevin. I believe that should work now. It might let me do it. Okay, if everyone, once I played it,
all the takeout orders. And when indoor dining resumed,
awesome.
Every hour or so, I would have to argue with somebody in the front who didn't have a mask.
Sure enough, last October, he got COVID and then brought it home to his whole family.
I'm pretty sure that I got it from arguing with somebody at work.
In December, California went into lockdown for a second time, and he was furloughed. The time away opened his eyes to what life with the family could be like if he didn't have to put in 50 to 60 hours a week at the restaurant or work on holidays, especially Thanksgiving and Christmas.
You know, I want to see my 1-year-old and my 5-year-old's faces light up when they come out and see the tree and all the presents that I spent 6 hours at night assembling and putting out.
So when he got called back to work last week, Gobieski quit, putting an end to his unemployment checks, which had been a cushion. He and his wife figure they have enough savings to last a month or two. So she told him, let's find something you're happy with. He's open to jobs in retail, maybe data entry. But one thing's for sure, he only wants to work 40 hours a week.
I think that this is clearly a real phenomenon where more workers are quitting than we've ever seen in the past.
Daniel Jal is a labor economist with the job site Glassdoor. He says in normal times, high quit rates are a sign of a healthy labor market.
They signal that workers feel more confident in order to actually leave their jobs and find a new one.
But right now, he thinks there are all kinds of reasons people are quitting. Some people may have just waited out the pandemic to leave a job that wasn't a good fit. Some people are quitting because they can make more money elsewhere. Professor Sidal Neely of Harvard Business School is focused on yet another factor. Thanks to the pandemic, she says, workers now feel empowered to speak up about when, how, and where they want to work.
We have changed. Work has changed. The way we think about time and space has changed.
And for a younger generation of workers, that could mean entire careers that look nothing like they would have before. Take Jonathan Caballero, a software developer working out of his basement in Hyattsville, Maryland.
This is kind of where I set up with screens.
He has 4 screens in his home office, also a whiteboard and a guitar.
When I'm tired of looking at the screen, I just pick it up and...
Music, he says, has helped him get through the pandemic. Caballero took this job last year knowing he'd someday have to go into the office. Now, with that day approaching, he's decided he'd rather not commute 45 minutes each way in a car he'd have to buy.
Yeah, I don't think I want that anymore.
He's only 27, but in the pandemic, he noticed his hair was thinning. He thought to himself, I need to start living.
I mean, I haven't really been through much of the US or the world. All the time I'm always like wishing, like maybe I wish I could be just working by the beach or something like that, and maybe after work just go swim.
Now, he's not uprooting yet. He owns his home and is working to fix up his backyard fence for a dog he got in the pandemic. But a couple months ago, he began looking for a job with better remote work options and soon had multiple offers. He settled on one and now is just waiting on a background check.
I think the pandemic has changed my mindset away, and like I really value my time now.
Yes, he says, there are bills to pay, but also life to enjoy. Andrea Hsu, NPR News.
More and more workers are saying...
Okay, so I think, can everyone still hear me? Okay, great. So the reason that I play this, again, these are different fields than health centers. These are different fields than specifically mental health providers. But the core takeaway for this is that there is not one key or magic bullet that's going to solve this problem. And really the workers, both who you have on staff in your behavioral health team, but also across the entire health center, and those who are coming to apply for the positions that you're putting out there are really going to be leading the conversation on how you're going to be able to keep them and recruit them into the health center. So the script has really changed and things have really flipped around in that way that we really need to meet those individuals where they're at and be able to provide them with what they're looking for. Because at the end, without that, people will leave, people will not apply for positions. Now we're going to talk about in this learning collaborative in, I believe it's session 4, like how to use job announcement language that, will attract those qualified mental health providers, how to put everything in place, and to have what you need. But it's very important to acknowledge that we're simply in a very different world, in a very different recruiting world. And there's not going to be one fix that sort of, can remedy this situation. So really it's leading and hearing what the people who are looking for the jobs want, what the people who are leaving the jobs want, and asking those who are there why they're staying. So this again goes back to that data informed component that is also really critical. Okay, so I want all of you to we're going to go into quick breakout groups. So based on what we just heard and I'm getting a weird feedback, but I don't know. Does somebody have a question? Was that? Nope. Okay. So we're going to go into hello. Sorry, I keep hearing feedback and I thought somebody was trying to ask a question. So we're going to go to a breakout group for about 10 minutes. And once you go there, I want each of you as a group to decide one of these questions. Either talk about how this great resignation impacted your work, how it has impacted your health center's mental health staff, or what is one change you wish you could make to tackle this problem. And with that question, it's really without boundaries. Now, of course, how much money you have, the leadership, all of those things will play into it. But I just want you to have these open discussions with each other to see what other health centers are doing, where you could share some ideas, but also your own frustrations with all of this. So Mariah is going to be putting everyone into breakout groups. When you go in, if you could just assign one person who's going to come back and report back, that would be great. And then we'll have a discussion in the main room. And then Mariah, whenever you're ready, if you could send individuals over into the breakout rooms.
This is Helen. Mariah's having a little bit of technical difficulties, so
Okay.
She can't unmute and is struggling to put people in breakout rooms. Michelle, do you have that host capacity?
I don't know if I do. Let me see if I do. Yeah, thank you everyone for understanding. Apparently today is just like not a good
Mercury's in retrograde, so
yes.
It's all going wrong.
Yeah, so I just really appreciate that. And I also want our learning collaboratives to kind of, I like it just to be kind of like a discussion. Things will go wrong. That's that's a great example for, I feel like, how recruitment goes. Things will go wrong, but we'll get it to work out. So let me see, I'm just trying to see if I have the ability to create breakout rooms or not. And if not, what I'll do is I'll stop sharing and we'll just, in the main room, we can kind of just have this discussion with each other. I don't believe I can. I don't have that capability. So what I'm going to do, everyone, I'm going to stop sharing just for a moment, and then I'm going to come back, and since we're all going to be in the main room together, I'm going to really select the second question on how how has this impacted your health center's mental health staff? And I'm sure many of you, the responses are very much going to be the same, but we'll just, we'll have that discussion for about 10 minutes. And then we will kind of wrap up with the rest of today's session. This is where I'm going to go into more of how we're going to look at these specific for mental health providers. But let me go ahead and stop sharing. Okay. Now I'm going to check one more time to see if I can actually do breakout rooms or not, but I don't think. Nope, unfortunately not. All right. Well, thanks everyone for understanding. So I'm gonna open it up to everyone. I'm happy to kind of go first as well, even though I'm not at a health center right now. But how has this impacted your mental health staff? Are you seeing just resignations across the board, or just in general when it comes to recruitment? So whoever would like to go first. Oh, Kevin?
Yeah, sure. Hi, my name is Kevin Miner. I am the Addictions and Integrated Behavioral Health Manager in Multnomah County in Portland, Oregon. And I think the two ways that it's impacting our current staff is, one, the individuals that are still here, and in the state of Oregon, there's just a shortage of mental health workers across the state. And so how it's impacting them is working with individuals and not necessarily having any community resources that they can refer to, or if they do refer to them, it's about 3 to 4 months of a waiting list. So that can be, very devastating, both for the patient and for the individuals trying to get them connected. And then in terms of resignations, one benefit, I guess, to working in a government/county entity is that, you do have a lot of individuals that have been here for a long time. And one of that reasons is because of retirement and also benefits. But what we are seeing is we can't compete with the health centers that aren't necessarily part of a union, are not government kind of based, and so that they can have a lot more flexibility in terms of speeding through the recruitment process and getting individuals onboarded, and then also offering a lot more salary compensation than we can. And so really what we target is individuals that want to work in a federal qualified health center, that want to work with a population that doesn't necessarily represent individuals that can access private healthcare. And we're just seeing a lot of burnout and a lot of individuals that are saying, like you indicated, that I no longer want to work in mental health in a capacity that requires me to work over 40 hours a week, or in a capacity where I have to come in and see people consistently versus, telework that seems to be, I get emails every single day about telework opportunities that, are much easier and also provide a lot higher level of pay than we can.
Mm-hmm. Absolutely. And thank you for sharing that, Kevin, because one of the things when we get into the conversation on compensation that we talk about that is a benefit in many ways, but it can also be a deterrent, is the mission that your health centers provide, and, bringing in the individuals who really care about working with these populations, but then of course also taking care of your workforce. So it's kind of a, it's like a balance between the two things, and why the pipeline development is so important. Try to get people early on to come in, and you may have great people in your health center that are working that this may be their goal one day to be a mental health clinician. And, you just may not know it, so how can you support that? But I saw Stephanie also, you had your hand up, so I wanted to be able to.
Hi, my name is actually Karen. Stephanie and I work together, and I think we have a shared link. But I work in DC. I'm director of HR for Community of Hope, and I don't know if I really have much more to add than what Kevin just shared. Our mental health providers are experiencing burnout. One of the challenges that we have here in DC is that the credentialing process takes so long. It's like our candidates are waiting forever to go through that process. So if they don't have the appropriate license, then they're not going to be able to work with us for 6, 8, 10 weeks. And by the time we get someone on board, someone else has resigned. And so it's like we're just playing catch up, and we can never, ever catch up. So we're just really, really struggling with keeping morale up on the team, trying to do what we can to service our clients, but also maintaining that trauma-informed care approach with our staff too, that we expect for them to share with their clients.
Yeah, that definitely credentialing and all of, licensure issues are such a huge difficulty in DC. I know I serve on boards outside of my work related to mental health work that I do as a social worker. And that is the constant thing that social workers talk about, especially in DC. And I don't know if this is the same in every state, but oftentimes license renewal is tied to if you have a parking ticket, they won't let you renew your license. If you have, any outstanding, like these things are very tied in. So, the difficulty in this conversation. So, what we hope to provide all of you are some tools and some tactics, but I also want to have these open conversations because a lot of times through this, it's kind of thinking through problem solving. But at the end of the day, it's like how to nurture your staff and make sure the people that you're recruiting in know that they're coming into a workplace that is going to nurture them and allow them to sort of move up in their career. So I think I have time for one more person before I go back to the presentation. Oh, Kevin, go ahead. Other Kevin, I just noticed there's two.
Yeah, I was just going to echo what Stephanie said and add a little bit to it. We definitely have that same issue with credentialing. We're both at FQHCs that have some of the same kind of standards. And, I'm in a situation now where I have like several new staff who I've hired who like I can't actually get to see clients for several months until they're fully paneled. And with the pool of applicants we get a lot of underqualified applicants who are like not fully licensed. And we get so many of those who we can't hire because then we can't get reimbursed for their time or their services. And I think the way the market is now is like for a lot of independently licensed clinicians, like it doesn't make sense to go apply at health centers because you can make a lot more money in private practice and not have to deal with credentialing or insurance or any of that stuff. And I think the thing I wanted to also add was just, coming from a trauma-informed lens, it's really hard to combat staff burnout when there is so much turnover through a trauma-informed kind of perspective, because we're asking clinicians to, help regulate clients and help with their triggers. But then like a lot of the work is so triggering to our staff because they are so overburdened and so overwhelmed that it's almost like a paradox of like do trauma-informed care, but the work is kind of traumatizing because we're dumping so much stuff on you because there's so much need. So it's a hard conversation to have some of this because there are a lot of like practical logistical things that get in the way of like really doing work that's important.
Absolutely. And that's when because it's again that balance between the reality of we're all people, we're all working with people, everyone's burned out, the whole world is traumatized, to then the actual practical application of, well, how do we get the steps we need to recruit someone? Kevin, what you were saying of getting people who are not fully licensed, that's something Dr. Ogonyemi, she talks about that in her session. But one of the things that was suggested, so just to bring up here was, does it make sense to bring someone in who isn't fully licensed, but have them do aspects of work with a licensed clinician where, the licensed clinician, all the billing can still be taken care of that way. But maybe like there was one clinician who talked about, she had her students come in and do like an initial 5-10 minute conversation with patients, or clients. And then they knew they couldn't bill for that, but it helped setting up the licensing requirements for that person. So then they could become licensed and then fully hired into the health center. And I know that that's incredibly complicated in and of itself, but when you're, when all of the people that you're getting have these deficits in a way, it's like, how can we think creatively with that to work within that and still be able to get paid and reimbursed for the work that is happening. So, yep, absolutely. Well, thank you everyone for sharing. I do want to just jump in. Oh, and sorry, apparently we also, Mariah's computer has frozen, so she can't run the evaluation. So we'll send all of that to you via email. And I just want to apologize. I mean, it seems like all of us here at ACU are computers, and we're not I'm in Florida, Mariah's in Virginia, Helen's in Colorado, that all of our computers decided at the same time to have technical difficulties. So I really appreciate just your understanding with all of that. But just to kind of wrap up, and this is more of kind of those technical skills that you're really going to be learning in this learning collaborative. So that's kind of the key of what we want to get. And when we talk about here at ACU, you know, we talk about workforce being the fuel. You know, without a workforce, you don't have a health center. You know, and many times, even that simple of a phrase, we have said to other health centers of bring that to your leadership, because sometimes there is also a very big barrier between leadership. What are the recruitment needs that take place? And then, you know, what are the finances? So there are a lot of moving pieces, but all of you as well, though, I feel like you really are the advocates for the workforce. You know, you're the people who are going to advocate for those needs. So as I said, the workforce is the fuel of your health center. At ACU, we also talk about core components that really need to be taken into account when we're looking at building a comprehensive workforce. So all of these, again, this is just baseline information. More so, I wanted to include it in the slides so all of you can have it after the session for your reference, because as we go through the other sessions, we're going to come back and look at a lot of these pieces. Again, this also matters because HRSA is also focused on this. So we're gonna, you know, we're also gonna put that in so that as you're doing this retention and recruitment plan for mental health providers, that's gonna be based on all the homework and all the sessions that we talk about, that you can also take that and put it into your comprehensive workforce plan, to the action planning, everything that you need to do as part of your HRSA requirements. So we really wanna hopefully multitask as much as possible so that there's not like a repetition of the materials you are creating. We also have a general definition of what is this comprehensive workforce plan. So all of these sections we're going to be looking at from the mental health perspective, especially, again, that fourth part, which is the recruitment. And we're going to talk about why a comprehensive workforce plan matters. So again, when you're looking at mental health providers, they're going to have their own unique needs, special considerations outside of any other type of provider. And it's important to highlight that, both because you're really taking the time to understand your behavioral health workforce and their needs, but also that's going to be apparent in the recruiting strategies that you are doing. But in the larger scope of just your health center, as you're putting together your comprehensive workforce plans and everything, you know, it allows you to do the exact same thing. You want to track the successes, like what is working in actually recruiting mental health providers. Because even in the worst of times, there's going to be something there that is going to be working, that is going to be positive. You know, even if at minimum, it's simply saying, okay, all of you who are here, who have stayed, who have wanted to stay, why? Why is that? Asking them that question, identifying those opportunities of, you know, where improvement can be made. And I think especially right now, there's a lot of opportunity for really being more agile, being more creative, you know, and again, I understand, you know, with federally qualified health centers, there's a lot more restrictions than there would be with other healthcare organizations or even just other industries in general, but there's still opportunities. And one of the fundamental things that you really want to do is use data to innovate all of this. So when I talk about data in regards to the mental health workforce, you want to look at, okay, first, what is our actual turnover rate? Not just, you know, all staff or all clinical staff. What is our actual turnover rate with our mental health providers? What are the root causes? So why are they leaving? So I mentioned earlier, a lot of people I know who have worked in the field as social workers, and these are individuals who have worked at health centers. They have been in their role for 10, 14 years, some a little bit shorter, but some much longer. And they loved being clinicians, making those connections with their clients, working with populations that they just felt so strongly about wanting to help. So that mission was a core part of it. But they also felt that they reached the point where, because they were mental health providers, nobody was looking at them for those leadership positions outside of being a behavioral health director, for example. Positions such as COO, CEO, those type of things that many of them would do an excellent job at, just weren't being offered to them. So that's part of that data that you want to collect. Like, what are the root causes specifically for your mental health providers? Of course, burnout, well-being, COVID, all of that is there, but I also want all of you to think even before that, how were things happening before, and what was happening, and how is that only further highlighted with COVID? And then finally, whatever your goals are, the mission of your organization, the vision, all of those things, ensure that all of the recruitment that you're doing, all of your comprehensive workforce planning aligns with those goals, and that you're able to take those goals, and again, you have that data, see the needs of your behavioral health workforce and align that to the goal. Because whatever your mission is and how you offer care to the populations you work with, you should also have that same support values to the workforce that is in your health center. And from what I've heard, many of you, I think, are already doing that, which is wonderful. And then this is really going to be the bulk of our learning collaborative. So we have this recruitment planning ladder, and really each of these steps builds on the other one. So although we are going to talk about each of them, I'm really going to highlight throughout the different sections very specific ones. So we're going to talk about the recruitment team. Who needs to be on your recruitment team? And it should be more than just HR or leadership. You really want to get creative. Who should be there? If you're hiring for a mental health provider, have somebody who works in the mental health team be part of that recruitment team. Advertising and social media, but especially job announcements. So one of the things that we did in our learning collaborative in the spring of this year was, I said, if you would like, send me examples of your job announcements. And I went through and offered almost like line by line, just different things on, the wording. Maybe this might be a way to capture someone, or this may be a way to talk to a mental health provider a little bit more specifically. How do you put in who is your health center? Who are you helping? What are the great things about where you're located? Everybody wants to live in a different type of community. And as hard as it is to hire in rural communities, there are people that are looking to move into rural areas. So how do you highlight all of that in your job announcements, the words that you use, looking at JEDI principles, so that justice, equity, diversity, and inclusion. So all of that sort of center part of the ladder, we're really, really going to be focusing on, because, and what we also heard from all of you in the cohort when you applied, one of the biggest challenges was, we're just not getting qualified candidates. So how do you attract those candidates? So I will be offering all of that to all of you again. If you want to send me your job announcements, I'm happy to offer you that one-on-one feedback. And you could start sending them to me now or later on in the learning collaborative when we get to the advertising section. But we found that to be incredibly helpful for people. And then this last part of the ladder, we're also going to be focused on sort of the the interviewing and the onboarding. How to really effectively interview mental health providers and then onboard them into your health center, the organizational culture you have. And I see there's something in the chat. Oh yeah, the one big question is where to advertise. Yes, we will. So and what I will also do is, because a lot of times when people ask where to advertise, they're also asking, how do you advertise at a place that you could get diverse candidates? So we have a building an inclusive organization toolkit where we list out different potential organizations to advertise at, but also going to the professional organizations, so National Association of Social Workers, and that's the one that I know is I'm a social worker, but the same with organizations with psychologists, licensed therapists. Oh, thank you, Helen. She just put on there the link to the Building an Inclusive Organization Toolkit. All of those things, go there. Use the alumni networks at schools. So I have my master's and my doctor of social work for the University of Southern California, and they have a really extensive, oh, here, perfect. And yep, and I see Helen put in job posting sites. They have a really extensive alumni network. Oh, awesome. Yay. Another Trojan. I'm so happy, Kevin. They have a really extensive network. And Kevin, you'll probably see this with many emails you'll receive from them. Utilize that. You know, utilize the people that are in your health center as places, as people who will be able to advertise for you. That's a lot of times where we get a lot of the employees that we have. So we'll talk about all this, but I just kind of wanted to give kind of a sneak preview. So absolutely. Oh, yes. Let me put in my email. Sorry. I'm trying to like, I'm not the best at keeping track of the chat while also presenting. So I appreciate, you know, everyone giving me the time to that. But yes, this is my email. It's also in the slides, just so you know, and the slides will also be shared. So you can have that there. But and then we're going to talk about onboarding, which then goes back around into retention. And this is just, so we get to the last few minutes. This is the last slide is recruitment doesn't happen without retention. So we really need to talk about these things in tandem, and we'll go through that. We'll talk about why, you know, compensation, benefits, work such as career paths, all of those are clear, but how one of your sort of strongest assets as health centers is your mission. But then how do you present that mission in a way that it doesn't feel like, you know, oh, someone's just going to sacrifice their career, their money, their this, their that, their time, their work-life balance, you know, to give to the mission. No, the mission should also be a supporting of your workforce. So I know that was a lot. And then here, this is one of the resources that we'll be using with our homework. This is general for all of the workforce, but I will be taking different parts of this template, modifying it for mental health providers and sending that to you as homework so you can fill out the sections of your R&R plan for mental health providers. I know that was really quick. We had a few technical difficulties and everything. Let me just stop sharing all the questions that all of you asked. Absolutely, we're going to be addressing that. I think it's absolutely critical. So we're really excited to have you here. Oh, Rhonda, I think you're on mute. Okay. Never mind. Yep. So I just want to see, just in this last minute, does anybody have any other questions? I don't think so. Okay. Perfect. So you will be getting emails from myself and Mariah. We're going to give you access to a discussion board, all of this, the recording for this, the PowerPoint, the homework, everything's going to be posted on there. You have my email in the chat, also on the slides. Outside of the job announcements, if you have any other questions, please feel free to reach out, and I'm here to help. And I really look forward to seeing all of you in our next session on the 27th.